这个是美国德州的心脏外科中心的主任和美国 AATS 胸外科的前任的主席。I just introduce you that is the director of the Texas Heart Center.
Yeah,
right? And used to be the president of the AATS.
That was a big honor for me.
Yeah, of course. We read the history of cardiac surgery.
Absolutely.
We know that Debicki and Cooley, the story.
Exactly.
And how do you comment that the relationship between these two guys?
Well, you know, it's interesting. It was back in the late 60s that Debicki and Cooley had their dispute. It was over an left ventricular assist device, and they did not speak for 45 years or some ridiculous amount. Finally, they were both very, very aged, and they met at a Texas meeting and shook hands. And it was a classic picture. The institutions, though, the Texas Heart Institute and Baylor College of Medicine, stayed separate until 2 weeks ago. 2 weeks ago, they signed a deal to work together moving forward. It only took 60 years. That's okay.
And today, this conference is about topics aortic dissection. I have been studying in Europe and United States too, and I know that there's a different strategy to treat the type A aortic dissection. In China, that most of the surgeons insist to perform the ascending aorta replacement and the total aorta arch and elephant trunk, so-called SANS procedure. But in America or Europe, most of the times we just replace the ascending aorta or dummy arch to save the life. And how do you think this difference, which is advantage or disadvantage?
Well, I think one of the differences is in China you've got very large centers that are regionally focused. So they have more experience at one institution, and they also have surgeons that take care of aortic surgery, surgeons that take care of mitral surgery, right? And sometimes they cross over a little bit, but not extensively. In the United States, it's capitalism. So if there's a surgeon in a very small center, he's going to want to do that surgery. So because that's how he makes a living.
You don't worry about the risk.
Well, that's why
lack of the experience.
Exactly, lack of experience. But also, these centers may not have easy access to a center with a big experience, like you would get in Beijing or Shanghai. So what we teach the everyday or common surgeon, they call them, that is faced with a dissection, that you should do what is safe to get the patient through the operation, and it may not give them a 10-year or 20-year outcome without needing further surgery, like the Sun procedure would do or something similar. But what you can do is get the patient through the surgery, recuperate them, they're doing fine, and if they need another surgery, say 1 or 2 years later, then they would refer that patient to the aortic center.
So when we talk about aortic dissection, there's a very important issue is the mortality. That's what's the real mortality post-operation in the real world?
Which it was in the 80s and 90s and early 2000s, because we didn't really know how to do the surgery well. But now we know how to do the surgery well, but we don't have a 0% mortality rate, and that's because the patients present with very, very potentially morbid. For example, abdominal malperfusion, that can be very fatal whether we do our best surgery or not. I think we have improved to a great deal. And I think with an experienced center, mortality rates in the 5 to 10% range, even closer to 5%, can be attainable.
Do you have something to say to Chinese?
Sure. Xi for being here, number one. But I think that you can feel very comfortable that the care that you receive in an emergency situation in China is as good as anywhere in the world. I've been in operating rooms here in China, and I've operated here in China with the surgeons. So I think I feel comfortable in as a U.S. citizen. If I had an aortic dissection today, I'd be just as happy to have it here in Nanjing as I would in Chicago, Illinois.
I'll take it as a compliment.
Absolutely. All right. Thanks for having us.
Take a picture, please.